One.
Prognosis. Multiple sclerosis is associated with high variability of disease progression. Luckily, slow progression is seen in most adult patients. There is no curative treatment. This is a lifelong disease that affects each individual in different ways. Life expectancy in the U.S. Is greater than 25 years, and interestingly, a study done in Norway showed the survival rate to be a median of 41 years long, doubling since 1969. About half the people diagnosed with multiple sclerosis experience some problems with cognitive function. For most people, the problems are difficulties with short term memory, attention, information processing, planning, visual perception, and word finding. General intellect remains unchanged and intact, including long term memory, conversational skills, and reading comprehension. The following clinical prognostic signs indicate a more positive clinical outcome: the female sex, young age of onset, optic neuritis or isolated sensory symptoms at onset, long interval between initial and second relapse, no more than 2 relapses in the first year, no accumulation of disability after 5 years of disease evolution, and then normal or near normal MRI at onset. Signs and symptoms that are likely to lead to unfavorable clinical outcomes are a progressive disease course. So, over the course of time, symptoms become worse and worse. An action tremor, pyramidal symptoms, so like tardive dyskinesis, pseudoparkinsonism, dystonia, and then truncal ataxia, which is the drunken sailor gait. Patients with multiple sclerosis who eat a healthy lifestyle, so good fats, proteins, and fiber, and have a good balance of exercise and rest, tend to be on the lesser side of the disability spectrum. Smoking has shown to increase the disease progression and exacerbate symptoms significantly. The best advice for a multiple sclerosis patient who smokes is to completely quit smoking. Physical exercise is beneficial. Walking, swimming, walking the dog, doing these physical day to day activities have shown to improve clinical signs and symptoms. The University of British Columbia has just highlighted 12 genetic mutations that lead to an overactive autoimmune system that attacks glial cells. This is a big step in the advancement into possibly for a definitive treatment, because if these genes are identified, then potentially they can be turned off, or um, the treatment of the disease can be better tailored to each person's genetic makeup.